Hey, this is Dr. Clay Williams at the University of Texas Health East Texas Medical Center in Tyler, Texas. I want to talk to you briefly about overactive bladder, or OAB, if you've tried and failed medications such as Gemtesa, Myrbetriq, Vesicare, Ditropan, Oxybutynin, Tolterodine, Enablex, Toviaz, Cinctura. There's a lot on the market, right? And if one of those or a combination of those are not relieving your symptoms of urgency and frequency, or if you don't make it to the restroom on time, you tend to leak urine, then we can offer you what's called bladder Botox injection. So you're thinking, wait, Botox, the same stuff that we put in our face to temporarily paralyze the muscles to get rid of the fine lines and wrinkles. Yes, that Botox has been used in multiple areas in the body. And Botox is really a trade name for a botulism or botulinum toxin. I mean, there's other brand names, Juvo and Daxxify, but Botox is kind of the accepted name for all botulinum toxins. Kind of like if you or your friends want to go get a Coke, you may actually get a Dr. Pepper or Sprite, but it's kind of this, this word that means anything, right? But basically, when we inject the bladder, it's an office procedure. It requires no anesthesia, it only takes a few minutes. And so we go in through the urethra, the urinary channel, into the bladder, and on the back wall of the bladder, kind of low, but behind the floor of the bladder, where most of the nerves are, we inject the back wall with approximately 1 cc injections of the Botox at approximately 1 centimeter intervals with 1, 2, or 3 parallel rows, depending upon if we do 100, 200, or 300 units. So what are we trying to do? Well, the bladder is made up of 3 layers of muscle called the detrusor. So just like you have a biceps or you have a triceps, the muscle of the bladder is called the detrusor. And so just like anywhere else you get Botox, if you inject it into the bladder, we are trying to temporarily paralyze a small portion of the nerves of the bladder from 4, 5, or 6 months. And while we're doing that is we're trying to decrease that sense of urgency, that frequency, and try to stop that, involuntary contraction of the bladder, which causes the leakage. And so it's a very simple procedure. And so if you're plagued with this urgency and frequency, and you've tried medication and it has side effects, or it's not a complete resolution, you didn't get a home run out of it, look up bladder Botox injection. Find a urologist you can speak to about it. You can contact me at rclaywilliamsdo.com, at my urology website. You can find me at the University of Texas Health East Texas website as well. I'd love to talk to you about the pros and cons about bladder Botox injection. So I hope this helps. Many of you will probably see this and be like, oh my gosh, I didn't know you could use Botox in that area. And what a great possible resolution of my symptoms. So I look forward to speaking with you soon. Have a good day.